Another common injury that I see in my office is ankle sprains or ankle instability. It can occur typically in a younger patient, an athletic patient who injures himself. Again, we think of soccer and basketball, it's probably volleyball as the three major sports-based sources for this injury. A patient will typically land, twist the ankle, which will typically roll to the outside. And patients will describe pain and swelling. Sometimes they'll actually hear or feel an audible pop. That is typical of the presentation of an ankle sprain. Patients come in swollen, they're bruised up, they have difficulty bearing weight on the ankle. Sometimes they may have gone to an emergency room or a primary care center. They've had a set of x-rays. Typically those x-rays are normal because an ankle sprain is an injury not to the bone, but again to the ligaments that support the outside part of the ankle joint. Ankle sprains are graded. Historically, there were 3 grades of ankle sprains. In short, those three grades are based on the severity of the sprain. Mild sprains are simply a stretch of that ligament. Grade 2, or the second grade, is a partial tear of those ligaments. And the third grade is the more severe type of sprain, where the patient will present with a complete disruption of the ligaments on the outside part of the ankle. The good news is that whether it's a 1, a 2, or a 3, ankle sprains routinely are treated non-surgically. The goal of ankle sprain treatment is control the swelling, ice and anti-inflammatories, protect the foot, either in a lace-up type brace or more commonly in a removable boot, usually for 2 or 3 weeks, and then begin a rehab program working on strengthening and flexibility and returning the patient back to activities in sports after the swelling and bruising has resolved. So here is a foot model and ankle model. And when I'm talking about ankle sprains, we're primarily talking about an injury to the outside part of the ankle. So you can imagine a patient who hits the edge of a curb or, again, playing sports, lands on another player's foot, and the ankle rolls to the outside in this fashion. What is injured in the ligaments we talked about in the grade 1 to 3 sprains are really 2 main ligaments that run off the bone on the outside, called the fibula bone. The main ligament, or the 2 main ligaments, run from the fibula bone. One attaches here, again on the outside part of this bone called the talus bone, and another runs at about a 90-degree angle down to the calcaneus. Those are the 2 ligaments that are typically sprained, stretched, or in some cases torn during an ankle sprain. As I mentioned before, and it's a little counterintuitive, I mean, it doesn't quite make sense, but an injury in which there is complete disruption or tear of the ligaments will heal, in the vast majority of cases, conservatively. That's the benefit.